So malignancy is something that we see not so often in dermatomyositis. It's something everybody is very fearful about, and we are now have some guidelines, but there's really not very much data about how to monitor or how to work with identifying or what is a proper workup for dermatomyositis and malignancy. And so one of the things is that when people are young, it's very unlikely that they're going to have a malignancy. And if, we still will, for instance, look for, with a transvaginal ultrasound in young women to make sure they don't have ovarian cancer, which can rarely be associated. And if there's a family history of cancers, we sort of very much pay attention to that and maybe think about a mammogram even in a younger person. As people get older, the risk of malignancy in the setting of dermato becomes more common. And so we will often scan initially when they're diagnosed to make sure that we don't find and the cancers can be in different places, so we have to do a certain number of scans in order to really look at that and look in the blood and so on. And then that can be repeated, typically maybe once, because the increased risk of malignancy is really in the first 2 to 3 years. And then after that, the risk really kind of goes down to almost baseline. I mean, you still need to be vigilant and get usual kinds of screening that you would do anyway, but we don't do a lot of extra screening at that point. And I do think one of the things is to kind of try to reassure patients, because there's such a fear of cancer, and it's really not as prevalent as people think, and especially in the patients who have skin-only disease, it's not so common. So we look for it, but it's not like it has to happen.